a sickle cell expert or a pediatric hematologist with bone marrow transplant expertise, I would like to touch upon a very basic, simple but extremely important topic, and that is recognizing fever in sickle cell warriors. Why is fever a very important symptom? Why is it something that has to be picked up at the earliest and managed at the earliest? So sickle cell patients don't have a functional spleen. Spleen is basically an organ in our stomach, in our abdomen, just like the liver, that helps us fight infections and also cleans the blood on a regular basis. The reason spleen is important is mainly, as I said, it provides an important part of your immune system or your power to fight infections. So our sickle cell warriors don't usually have a functional spleen because of various blood clots that happen at different levels. The spleen may not really be present in its full function. So these patients, even when they get a low-grade fever, which may be a normal temperature for a normal child who doesn't have sickle cell anemia, even if a temperature of around 100.4, 101, it is of concern because we worry about life-threatening severe infections in these patients. So it's important to recognize, keep a close eye on your child's activity at the time when they have a fever, pick it up at the earliest, start oral fluids as soon as possible at home, make sure that they're assessed by their pediatrician or by their pediatric hematologist because they might require a course of antibiotics. Also ensure that the child, if they're on Pen B or penicillin, that you should not miss or skip any doses because that would put the risk, that would increase the risk of infections in these children. Make sure to keep an eye on the fever profile and the activity of your sickle cell warrior so you can prevent a lot of emergencies just by being careful at home.